Good evening, everyone, and happy Thanksgiving week. We're so excited that you're joining us here tonight for Dr. Ridgley's final session of 2024. Hard to believe, I know. And she'll be talking to us tonight about my neck, my back, and natural ways to help chronic pain. So feel free to ask any questions you might have in the chat section. And Dr. Ridgley is very happy to do this series again in 2025. So if you have some topics that you'd like to hear more about, please put those in the chat as well. We'd love to hear from you. So Dr. Ridgley, thank you so much for a great year of absolutely fascinating and informative sessions. And so we're looking forward to this one.
Hi, hello everyone. My name is Dr. Ridgley. It's Jessica Ridgley. I work here at HCA Health One Sky Ridge Primary Care in Lone Tree, and my email is at the bottom if there are questions that do come up. But tonight we are going to talk about natural ways to help chronic pain, which is something that I do a lot in my clinic, as I also do osteopathic manipulation as well as internal medicine, and I also do integrative medicine. So a lot of what I do this on a daily basis, and wanted to kind of help bring this a little bit more forward for people who might be struggling with this. All right, so let's get started. So tonight, what we're going to talk about is we're going to plan to eliminate chronic pain as much as possible. It's important to understand what pain is. It's also important to understand how we typically manage pain and why some of those can be very helpful, as well as ways that we can look outside of that pain box and things that we can do for ourselves. Supplements that can help with pain, and also botanicals that can be very helpful with pain. So exactly what is pain? So pain is something that our body uses as a way to tell us something is wrong. But the reason why this is a pain cycle is because any area can be the starting point of pain. You can have decreased function, such as a trauma, that then causes you to have that psychological stress, which causes more pain, which then causes muscle guarding. You can also have psychological stress. I mean, a lot of people have had problems with stress that then develops into pain. A similar one is fibromyalgia, which people understand a little bit more. And that it can cause pain. And then because you have pain, you don't want to do anything. And then you start to get restricted range of motion. And because you don't do a lot of activities, then you start to have some muscle weakness and atrophy and so on and so forth. So the pain cycle can start anywhere in here, and there is very much a psychological component of not wanting to create that pain. So then we do whatever we can to stop it. In acute pain, this is a great thing. In chronic pain, it is not the best thing. So there's ways that we need to do to try to stop this cycle. So typically, if you're having pain and say you hurt yourself, but then you kind of get over it and you start to have chronic pain, it's every day or it's every other day or it's coming up frequently, and you're like, I don't really want to deal with this, you go to your doctor. And the doctor is going to say, okay, well, this has been going on for a while. Excuse me. This has been going on for a while. So, well, let's see. Let's try medicines. Let's try physical therapy. Let's see what's going on with that. Sometimes you do both of them together. And then on top of that, you say that works a little bit, but you're still having some pain and you're not really sure what to do. Then the next thing the doctor's going to say is, well, let's do some imaging. Let's see if there's something underlying this. And, depending on what the imaging is, that might be an MRI, or an X-ray is almost always the first thing. And then there's going to be an MRI or a CT. And in looking at that, then we're going to decide, well, okay, let's take it to somebody who can do some pain management, some low interventional procedures, or maybe we say, hey, it's something that is going to require surgery. Over time and the body's mechanisms, it's come to a point where we now need surgery. The thing about surgery is sometimes it works really well when it comes to the musculoskeletal system, and sometimes it has its problems, such as when you do back surgeries that kind of limit areas of motion, it can then cause problems above and below that area. So we start to develop issues that can then cause more chronic pain as well. So although surgery can be super important, it can also have its negative effects. But that's typically how we would manage pain in a normal setting under in kind of the medicine environment. One of the most important things that we need to talk about is how important healthy living is to the pain. So when we're talking about acute pain, it's different. It's healing is going to happen. Hopefully, if we do things well and it's taken care of appropriately, it'll go away and eventually we don't have to worry about it. When it comes to chronic pain, you have to have and do things that focus more on a healthy living environment. So anti-inflammatory diet is super important. It's been found that pain patients, because of the stress, do seem to eat more sugar, salt, and some of the processed foods that we see in a standard American diet that can definitely cause a lot more inflammation. And that increase in inflammation does cause pain. Also, when we restrict our movement and exercise, then we continue to have increasing pain because we start getting increased restriction, as we were talking about in that pain cycle. It's really important to stay moving, and sometimes it doesn't mean that it has to be something that is going out and running a marathon. It might just be going out and walking a mile every day for a while and then moving up to something more as your body gets more used to it. Or if you have knee pain, you have to find a way, and you have to sometimes be creative into ways that you can add movement into it. It is also important to avoid the pain triggers, because when your pain is triggered, then you start to have more anxiety, and that can also increase the pain. So you do have to avoid the pain triggers, and that's where being creative with your movement is really important. Stress is very important when we are looking at pain, as increased stress does cause increased inflammation and can cause increasing pain levels. So it is important to find that self-care and things that you can do to decrease the stress, which we will talk about more in this in the webinar. And then also getting enough sleep. That is so, so, so important in making sure that your body is able to manage. When you do not get enough sleep, you actually have endogenous pain inhibition, which causes increased joint pain and increased pain in general. Part of some of these webinars that I've done, I have done I've done one nutrition video, and then several of my videos do have a very heavy component of nutrition and anti-inflammatory diet. So if you do have questions about that, you can refer back to those. They're on YouTube under my name. I also did a sleep webinar called DreamWorks, and that has a lot of recommended things as well. So if you're having difficulty getting sleep, it may be due to chronic pain, and maybe some of the things in here can be helpful, or the pain may be worsened because you're not getting enough sleep. So finding what you need to do to get more sleep is really important. All right, so moving forward, no, I do not have Tourette's. I have back pain. Please pardon my sudden outburst of obscenities. So we've kind of talked a little bit about inside the box. And tonight, what I really want to focus on are things that are not normal things that you might find when you go to your doctor that could be very helpful when it comes to chronic pain. And I have a little bit of a story. There was this girl that after college had a significant amount of pain up and down her back. She'd been through multiple motor vehicle accidents. They were pretty minor overall, but she'd had a lot of strain through there. And then she went on to college and did powerlifting. And she didn't stretch the way that she should have. So the powerlifting caused a lot of inflexibility and restricted motion. And as she started to get a year or two out of college, she started to have a significant amount of pain. And she was in the military, so people were like, well, just go to the doctor. And she considered that, but she also knew that if she went to the doctor, that in the military, a lot of times they would give you vitamin M, or what people in the military name Motrin. And she didn't really want to do that. So she started to kind of look at other options, and she did go to chiropractic, and she found that between the chiropractic and the electrostim that it helped quite a bit. But over time, she would start to have the symptoms come back, and she wasn't finding that it was helping long term. So then she started to she actually went to massage school, and she started getting massages, and she noticed that helped a lot. And with the manipulation, that helped even more. And so that was helpful. And then she started to do yoga. And as she was doing yoga, she noticed that that helped even more. And so she started to kind of do these things. And she eventually found osteopathic manipulation and did start to do that as well, and found that that was even significantly more helpful because she'd worked through a lot of different problems, but she was continuing to have certain pain issues. And as she continued to work through that and found OMM, she found that OMM really helped in specific little places that she just wasn't able to get through with the yoga and massage. And after about 3 or 4 years, she got to the point where she really, on a day-to-day basis, did not have pain. And as a matter of fact, she would go for significant periods of time, and unless she did something specific to cause pain, that she didn't have the pain. And that person is me. This happened in my 20s, and it definitely took a lot of work and consistency and dedication to improving my pain, but it definitely worked. And so some of the things that I did, I'm talking about in this, and some of them are ones that I have tried, or I've had other people try, or I've done a lot of study on, and they have a lot of scientific background to help with different kinds of pain. All right, let's look outside of this box. So outside of the box, we do have some manipulative techniques, which is becoming a lot more common, which I think is great. But they are still considered a little outside of the box. We have meditative movement therapies, which can be very helpful. When I was doing yoga, that's what that was. Massage can be very helpful. I think that massage is very helpful in conjunction with a few others. There's also certain botanicals and supplements that can be very helpful. There's acupuncture, frequency therapies, which I will get into further to describe what those are, water therapies, and then mind and body therapies. And I'm actually going to start with the mind and body therapies because psychological stress and how we view our pain has been shown time and time again in studies to also cause how much pain we're actually having. So let's start with that. So some of the things that can be very helpful with pain in regards to mind-body is things like biofeedback and neurofeedback. So these are different techniques which approach a very similar endpoint with two different ways. Biofeedback is where they take sensors and actually monitor your your physiological reactions to things. And then you learn to control these physiological reactions during the time that you're doing it. One of the examples of this is heart math. Heart math is actually a really interesting little program where you can get a sensor that you can even hook up to your phone, and you connect it to your ear, and you can go through these different types of programs, and it helps you to learn how to manage your physiological stressors. Neurofeedback is a little bit different. It actually uses your brain waves to affect how you're being affected physiologically. And this one is a little bit more passive than biofeedback. I actually do neurofeedback now, and you basically have things hooked up to your head. You watch something and you get positive feedback like the screen brightening or sounds in your ear if your brain waves are doing what they want them to do. And it starts to train your brain to go into a place that is healthier for you in a sense. So neurofeedback is also something that is super interesting and can be helpful. If you have had psychologically traumatizing experiences, my recommendation is to look into EMDR, or eye movement desensitization. This actually helps to decrease the stimulus or PTSD type of stimulus that you have from those traumatic events that can also increase pain. So when it comes to fibromyalgia and those types of pains, a lot of time EMDR can be super helpful if there's an association with a traumatic event. Another type of training that can be very helpful is like what I spoke about with meditative movement. Meditative movement, like yoga, can be very helpful. It not only does strengthening and stretching, it also helps with learning to breathe appropriately. That's the meditative aspect of it. And it has been found to be very helpful with pain, typically more in the beginning than later on, but it definitely helps with that. Tai Chi is also a meditative movement practice that uses specific types of movement to get into a meditative state. And there's also learning to control your energy levels and that kind of thing. And then I have a picture of just somebody meditating, which kind of leads me into the next thing. Mindfulness-based stress reduction is a type of meditation that, when they have done studies, has been the most profound when it comes to managing pain from a mental perspective. It was developed by John Kabat-Zinn, and there is a lot of online and in-person 8-week programs, honestly, probably right around the corner for most people, to do this type of work and actually learn to help with pain. So this can be helpful as well. I think people with and without pain could definitely learn to do more meditation. I know that I could, but this has definitely been found to be very helpful when it comes to pain. So those are kind of the mental things that can be helpful in regards to pain and chronic pain. Now let's go into a few other things. There is also manipulative techniques. Manipulative techniques, basically your osteopathic manipulation and chiropractic. Massage kind of falls into that, but it is very important to understand that a massage therapist is not trained to diagnose a dysfunction in the body, where chiropractors and osteopathic doctors are able to do that. Some differences, they do have a different paradigm. A lot of times they use some very similar techniques, like both use HVLA. Not very many osteopathic manipulation physicians use an activator that I'm aware of, but they do have very similar techniques. The paradigms are slightly different by the fact that osteopathic manipulation is based more on functional movement and is not based completely on spinal alignment, which the basis of chiropractic thought is based on spinal alignment. It also, osteopathic manipulation uses many different techniques, everything from muscle energy to cranial. Cranial was actually developed by osteopathic manipulation by a Dr. Sutherland. And chiropractic usually uses high velocity and activators, but they also have a lot of tools that they've used to kind of help save their bodies, which I think is awesome. They also use a lot of e-stim and that kind of thing. And osteopathic manipulation has actually been found to be effective in hospitals for post-surgically for pain, other complications that have to do post-surgically, and have actually been found to help with decreasing length of stay and things like pneumonia and COPD and things like that. Both of them have been found to be effective in neck and back pain in studies, and effectiveness does depend on the experience of and the training of the individual doing it. One of the things I have to say, because osteopathic manipulation is more based on functional movement, we do look at a lot of the other joints as well and how they play in, so it's not just the spine. And also osteopathic manipulation physicians also have a 4-year, in the United States, have a 4-year medical degree. Not the issue is that only about 10% of osteopathic doctors utilize OMM, whereas chiropractors, pretty much all of them come out using it. And I think both of them is very important to kind of look at somebody who has a little bit more training and is continuing to do their training to get the best effect overall. And it is important to make sure that your pain has been evaluated completely and there's not something that could be worse through manipulation. So that's very important to make sure that we kind of understand what the underlying issue is before you use manipulation. All right, going into one of my favorite topics, and that is grounding. So, the important thing to understand about grounding is that over the last 100 to 200 years, we have started to disconnect ourselves from the Earth's surface, literally. So, the Earth's surface is actually electronegative, and our body's processes and the things that it does actually creates oxidative events that makes it more electropositive. When we are actually in contact physically with the earth, not between rubber shoes or having a house that has wood, and both of those are non-conductors. If we are physically in touch with the earth, the electronegative particles from the earth's surface helps to neutralize the electropositive particles in our body. This specifically decreases inflammation, and it can help to regulate hormones, improve homeostasis. It can decrease pain, decrease stress, improve wound healing, help sleep. It can regulate cortisol, which is a hormone, and it can boost immunity. All of these things have actually been found in scientific studies. And I think it is really important to understand that these things can happen through literally putting your feet on the earth. Now, it's really cold outside, so I don't know if I recommend that because I don't really want you coming in with a cold either. So one of the things that you can do and things that they do have is they have things called grounding sheets that you actually put on your bed. They're grounding sheets, grounding mats. They even have grounding pads that you can actually place on areas of the body specifically to have that focus in that area. And one of the ways that they can do that inside the home is actually using the grounding of your own home to bring those electronegative particles to kind of neutralize some of that inflammation and stress. A couple places that you can go to get these is grounding.com or earthing.com. Earthing.com is actually where this kind of started. And they do have the book that describes how this was kind of figured out and does have a lot of scientific studies in them as well. But it's really easy to find the scientific studies, and they're actually really profound. So either doing, getting your bare feet on the earth or grounding mat or a grounding sheet is super important to help with pain. I use all my kids and my own bed have a grounding sheet on it to help with this. Now, I will say that we will go to certain classes or meditative classes that get grounded. That's figurative, that's not literal. And the type of grounding that I'm talking about is literal, like putting your feet or putting your body in touch with the earth, or having a mechanism that you can actually get those electronegative particles to actually help interact with your body. So this is a type of frequency therapy, but it's not exactly frequency therapy. The next thing that I'm going to talk about is more of your frequency therapies. And this is your light therapies, are also called photobiomodulation therapy, called light therapy. Different lights, a lot of the infrared saunas will have different lights, and they do help different things. Some is mental effect, some is physical effect. The two big ones that affect mental is I'm sorry, not mental, physical would be your red light therapy, which helps specifically with musculoskeletal and inflammation. However, if you have fibromyalgia or migraines, you may do better with green light therapy. So one of those two can be very helpful. Red light therapy is actually super interesting. You can get pads that you actually put directly on a joint that can be very helpful in decreasing the inflammation, and also to decrease any swelling or that kind of thing, and actually bring about healing. The next one is pulsed electromagnetic frequency. This is a pad that has a certain frequency that kind of comes through it. It's not a light therapy. And it has been found to help from everything from bone repair to muscular repair, boost immunity, help with blood circulation, help neuroplasticity, and pain relief. So all of these have been actually very helpful, and you can find them sometimes in different gyms or things like that, but you can also buy the mechanism to do this as well. I think that the frequency therapies are actually super interesting. I do love red light therapy for osteoarthritis and for any kind of joint issues. I would also recommend it if you do have an acute injury as well. All right, we have to talk about acupuncture. So acupuncture is the use of energetic lines called meridians. They've actually proven scientifically that these energetic lines do exist. It has been used in Asia for millennia, and it's been used in Asia for multiple different things, from pain all the way to anesthesia during operations. So super interesting. In the West, it is mostly used for pain, and it works really well for pain. And the important thing to know is that insurance will only cover low back pain at this point, which is kind of a sad thing. I think it works great for migraines. I have several migraine patients that I use osteopathic manipulation, and we'll get to a point where they're doing really good, but they still have a certain amount. And once we kind of introduce acupuncture, I've noticed that it helps significantly. So I really like acupuncture for pain issues, and not just migraines and low back pain. Like, you can use it for a lot of different types of pain. Water therapies. So water therapies are interesting. There's balneotherapy, which is using mineral waters to just kind of relax in them. And that is something that you can even do pretty easily kind of near you. They do have water therapies that are kind of becoming more popular. One of them is like a desensitization tank, which basically fills this egg-like shaped thing with water, and then it has about the amount of Epsom salt as the Dead Sea has salt in general. And you kind of get in there and you just float, and it's pretty easy to float because of the amount of salt that's in there, and it can be really helpful. From a muscular ache and pain kind of thing, but it also can help with joint pains. It is used more in Europe, but it is definitely becoming more popular here as well. You can also just take Epsom salts and put it in your own water, and I don't recommend just a cup. I'm talking like dump the bag in it, because you're going to get more magnesium, because that's the type of salt is magnesium sulfate in Epsom salts. So if you're going to like take a bath and put Epsom salts, I mean, get it in there, and definitely make it as warm as you can stand and kind of stay in there until you feel relaxed and ready to come out. But you will get a lot of magnesium through that. Another type of water therapy is called cryotherapy. And yes, you could just go polar bearing. That is one option. They also have cryo tubs that you can use. It's very cold, and definitely use a lot of obscenities when I use it to start with. So it's a good thing that I'm around my husband or myself only when it happens. But cryotherapy is super helpful. It can improve, short amounts of cryotherapy can improve mood. It can help to control the nervous system. It can boost the immune system, improve sleep. I can definitely say the sleep helps. I actually did a cryotherapy where you go in and you go to like negative 150 or something, and you stay in for only like 30 seconds to a minute. And I remember coming out of this, and I could have slept for 4 hours afterwards. I was so tired. So it definitely can help sleep, especially right away. Decreases inflammation. It can decrease pain. It gives you good boost of energy and faster recovery. They even have an interesting kind of thing that's up and coming now called a fire and ice treatment. And what it is you do a hot sauna, hot infrared sauna. You can put red light with it, and then you jump into the tub, this cold tub that's like 48 degrees, and you do that for a couple minutes, and then you get back in the hot sauna, which feels amazing afterwards. And usually it lasts about an hour, so you can get in the cryotherapy, 2 to 3 times, and get in the hot sauna, and it can definitely be very beneficial. That will make you laugh, especially if you do it with somebody. So, but it's a lot of fun. But the water therapies can be very helpful, and when it does come to the psychological stress of pain, it can definitely help to reduce a lot of that because of the type of neurotransmitters and endorphins that it kind of sends throughout the body with the cryotherapy. So water therapies can be very interesting and useful. All right, let's talk about our supplements and botanicals. So I kind of broke this into ones that can be utilized, like which ones can be utilized for what, because it is a little bit different. One of the things that can be utilized for almost anything is magnesium. I didn't put it under neuropathic pain because it doesn't directly affect the nerve, but it does help to reduce the strain and the muscle spasms that can happen with neuropathic pain. So magnesium can be helpful for that too. But for the most part, magnesium can be used for so many different types of pain. One of my favorites, and as long as you have good kidney function, it's not a problem to use higher dosages. But let's talk about headaches. So when we're talking about headaches, mainly talking about migraines when I talk about these supplements. However, you can also use them for the magnesiums for sure, and the CoQ10 for tension headaches as well. So when we're talking about CoQ10 is a really important substance that our body actually makes, but a lot of times as we get older, our ability to have CoQ10 available in our body does decrease from different stressors or an ability to have the products that it needs to create the CoQ10, it can decrease. And it is super important in our energy pathways. It has been found to be very helpful with migraines. And I can tell you that although I love magnesium for migraines, I have found CoQ10 to be more helpful. And I typically recommend around 200 milligrams for the CoQ10. Butterbur is a very interesting one. It's an antispasmodic. So one of the reasons it works for migraines is that you can have vascular spasm in the brain that triggers it. So Butterbur can be very helpful, but it is something that is recommended to do every single day with that one. Feverfew is an anti-inflammatory. That one can be taken when the migraine happens. You'll know whether it works or not, if it works for your migraines or not. Couple times you're going to know, yes, it worked. No, it didn't. So another one, which I like to put migraines and fibromyalgia very closely together. And one of the reasons is because I kind of feel like fibromyalgia is a migraine of the body. The magnesium does help with that. I also find that CoQ10 does, but I actually got this list from something that had good scientific basis. So I didn't really look up the CoQ10 of fibromyalgia, but I've seen that to be helpful in my own practice. But one of the things that can be really helpful for fibromyalgia is something called SAMe. And that is a amino acid that our body develops. But what happens is as we go through stress and pain, a lot of times that SAMe gets reduced. It is part of the energy pathway, the Krebs cycle. So ensuring that you have more of that actually does help the body quite a bit. And it can also be helpful in the stress and strain of the fibromyalgia from a mental perspective, because SAMe has been found to be as effective as SSRIs in depression. So SAMe can be very helpful when it comes to fibromyalgia and some of the strain that comes with fibromyalgia. Another aspect is adrenal herbs. And when I'm talking about adrenal herbs, I'm talking about adaptogens. Things like ashwagandha and rhodiola have also been found to be helpful in fibromyalgia. So let's talk about rheumatoid and osteoarthritis. They are very different. One is an autoimmune disease, and the autoimmune disease causes inflammation. One is wear and tear on the joints, along with a lot of times dietary inflammation that then causes problems with the joint itself. They are very different. So they aren't the same thing, but they are arthritis, and they both do affect the joints and are very painful. So when it comes to rheumatoid arthritis, a lot of your healthy anti-inflammatory fatty substances can be very helpful. We're talking about omega-3s, talking about gamma-linoleic acid. Those are things that have like a fatty component to it that can be very helpful to reducing inflammation. Magnesium can help the muscle spasm that can happen because of the pain in the joints. And there's an interesting one that I found called the Thunder God Vine, which I do not recommend taking it internally. It has not been found to, it does have side effects and it can be harmful. But topically, the Thunder God Vine for rheumatoid arthritis has actually been found to be very helpful in scientific studies. When we're talking about omega-3s, I am talking about the ALA, which is mostly found in your seeds and nuts. But I'm also talking about the DHA and EPA, which can mainly be found in either algae or in fish. It can also be found in things like grass-fed beef, pasture-raised chicken, eggs from pasture-raised chicken, wild meats. If the animal is fed appropriately, like grass instead of grains, they will produce omega-3s. Your fish has more omega-3s than your steak and your land animals for the most part. Just to know where you can get that, or you can supplement it. Osteoarthritis, one of the things that can be really helpful is turmeric. Turmeric has been found in studies to be as effective as ibuprofen used on a daily basis and has a lot less side effects overall. I do recommend getting a good supplement and not just buying anything over the counter, because it can be also harmful in the fact that it's a root, and depending on where that root is grown, it can pick up heavy metals. So the supplement itself needs to be a clean supplement. I do like Nature's Made. I like Kirkland brand, and another one that I really like is Gaia Herbs. I think their turmeric supreme is excellent, and their turmeric supreme for pain is even better. And the turmeric supreme for pain actually has devil's claw in it, which also by itself has been found to be as effective as ibuprofen in studies. And so that's really helpful as well. It's very anti-inflammatory, and it actually inhibits the pro-inflammatory gene expression of pain signalers. So that one's a really interesting one. Another one is SAMe. Again, that's very helpful. It is very anti-inflammatory and can also help with the mental effects that come with chronic pain. Willow bark is the herbal component, or the herb where aspirin was found, and can be helpful, just like aspirin can be helpful. Ibuprofen taken long-term can definitely have a lot more side effects, so you have to be careful with that. Willow bark does not seem to have the same amount of side effects, but you still have to be careful. And then omega-3s as well for osteoarthritis from the anti-inflammatory component. And then we were talking about neuropathic pain. We're talking about issues where you have radiation of pain, or even peripheral neuropathy, those types of pains. One of the best ones for that is alpha lipoic acid. And the recommended dose for that is around 600 milligrams. That's a really good one for neuropathic pain. There's also some underlying, like if you have MS and you have some neuropathic pain from that, or some of those other things, alpha lipoic acid can be really helpful. Vitamin B12 can be helpful only if you are deficient in vitamin B12. Taking excess vitamin B12 just to take it does not actually help, but neuropathic pain can be started and worsened by vitamin B12 deficiency. So then we come back to the low back and the neck pain. Turmeric, super helpful with that for the same reason it is for arthritis. Devil's claw, same reason it is for arthritis. Vitamin D, honestly could be in probably all of these as well. Low vitamin D enhances pain, increases fatigue, and overall makes you feel unwell if you have severe vitamin D deficiency. So making sure that your vitamin D is within normal limits is very important when it comes to pain. Willow bark can be helpful as well, and magnesium. Magnesium is super helpful. So these are some suggestions that you can use. My favorite, honestly, is turmeric and magnesium when it comes to pain. So I'm going to talk a little bit more about magnesium, because magnesium is really, really important mineral for our body, and 70% of us do not get enough. So what does magnesium do? We obviously know that it helps to relax muscles. It helps to improve joint pain, but it also helps anxiety, sleep issues, It decreases the emotional response to pain. Um, it can help with headaches. If you're really deficient, it can cause you to be a little lightheaded and dizzy. And if it can also cause your blood pressure to go up. So what can magnesium do? Well, it provides stability to the genome. So that actually means that it actually can help to make sure that you don't have kind of atypical production of things that you don't want to have happen from the genes. It decreases oxidative stress, so therefore it decreases inflammation. It helps blood sugar stability. So I use this also for people who have like prediabetes and diabetes to help kind of stabilize that. It relaxes the muscles, relaxes airways. So if you have asthma, super helpful to be sufficient in magnesium. And it actually inhibits development of amyloid. And amyloid is what is developed when the plaques are what's developed in Alzheimer's. So that can be very helpful, and it supports the immune system. So not only can it help a ton with pain, it helps a lot of different things. And I think it's really important to keep talking about magnesium because I think in general, our society does not get enough with the type of diets that many people eat. All right, so now we're starting to come to a close. My favorite childhood memory is my back not hurting. I think a lot of people could agree with that. All right, getting old is not for the weak. I have a lot of YouTube videos. I have one on nutrition, gut health and inflammation, diabetes, heart-related issues, cancer. I have one on dreams, environmental toxins, which I honestly feel is super, super, super important to make sure that you are well educated on the environmental toxins around you because how they play into our health are super important. And then my last one prior to this was cognitive decline and dementia. And then we did chronic pain today. So you can go to YouTube and search my name, and that will typically come up. For some of them, you do have to go down a little bit, but I have checked recently, and they are all on there. And this is my research. I wanted to make sure that I post that. So if you wanted to go back and find these pages and be able to look at them and look up the science behind what I put in this webinar, you can do that. So now I am able to take questions.
Hi, Dr. Ridgley. One of the questions that we received was, where do you get grounding sheets?
So grounding sheets, my favorite place is earthing.com, earthing.com. Grounding.com is another one. That's a newer one. I don't know the basis behind that one as well, but it is very popular and it has really good ratings. But earthing.com is the one you can actually get the book on it. They'll actually send it to you if you buy one of their products.
Okay. We had another question that came up about, you talked about, floating and the salt water. There are several floating centers in the
Mhm.
area. Are there any risks to using them, or do you recommend them?
I highly recommend them, and there's really no risk to them at all. They're very shallow, kind of areas of water, so you can't like drown in them or anything like that. So they're very safe. And even if it just helps with stress, it can be very helpful.
And we have one more, if you're okay with that. Um, can you take too much magnesium?
So you will know right away if you take too much magnesium because your bowels will get loosened and you will have a lot of looser bowel movements. So if you are taking too much or you're not tolerating it, you can always back down off of the amount. A good starting dose for magnesium is around 400 milligrams. And if your kidney function is not in a good range, then you can take too much. And I would not recommend taking more than around 400. But if you have good kidney function, 400 milligrams is a good dose. You'll know pretty quickly if that's a problem with your kidneys. I'm not your kidneys, not your kidneys, your bowels, and you have too loose a stool. And I just tell people to stop it until it goes normal and start at a lower dose.
Okay. Well, those are the questions we had from our audience today. So thank you, Dr. Ridgley, for always providing such great information.
Thank you, and I hope that I see everybody in 2025.
All right. Thank you.
Take care.